I'm Joe Tucker from the University of North Carolina and also the London School of Hygiene and Tropical Medicine. And this morning we're going to talk about how to do a systematic review. And we have the pleasure of being joined by Dr. Matthew Law from the University of New South Wales. He's given some input on the slides and will be with us for the interactive second half of this presentation. And Nathan Ford from the WHO unfortunately won't be able to make this talk, but he helped us to shape the content, and you'll see several examples. So first, I'd like to go through and let's see here. So what are our learning objectives this morning? First, we're going to highlight the differences between a systematic review and other types of reviews. And then we'll provide examples of the range of research questions to which systematic reviews can be applied. We'll summarize some of the key steps in undertaking a systematic review and meta-analysis. We'll look at some of the graphical elements that can be found in a systematic review. And then finally, we'll provide a few resources. And this is sort of the first half of the presentation. And then because this is so early in the morning and the caffeine probably has not started to work, the second half of the presentation will be interactive and a small group format. So before we get started here, how many of you have done a systematic review or are interested in doing a systematic review? Raise your hand. Good. Great. Fantastic. So first, we'll talk a little bit about some definitions here. What is a review? A review is a general term for any kind of synthetic production of results and conclusions where you take more than one publication and synthesize the evidence. A scoping review is a slightly higher degree of evidence, or in terms of hierarchy of evidence. It's a rapid review to identify the literature on a topic for a specific purpose, but it's not rigorous enough to be a systematic review. And for scoping reviews, Arksey and O'Malley have a nice description of this that sort of helps to clarify exactly what a scoping review includes. And then if you go into greater rigor, a systematic review is a review that strives to comprehensively identify and track down all the literature on a given topic. And we go to what's called the PRISMA checklist, and we look, can we do all of the things that are necessary to make this comprehensive? We also register a systematic review in a database called Prospero. And we'll get to that in just a few minutes. So why would we want to do a systematic review? It takes a lot of time and effort. It's not easy. What is the value of a systematic review? First, there's a huge amount of scientific data, observational studies, RCTs. So synthesizing this huge amount of data can be useful. And then secondly, decision makers only want the key bits. Decision makers can't be bogged down in this huge raft of data. Efficiency, so this is cheaper. If you do a systematic review, it's much less expensive than doing a new randomized controlled trial. And then generalizability, consistency, increased power. So if you have a larger number of studies or individuals, it allows you to have greater power. So a couple of quick quiz questions are sprinkled throughout here. Your mentor just finished a huge RCT, and she or he says, all right, we're going to submit this to the Lancet Infectious Diseases. We don't know what the value added is. We need you to come up with that little box that says research in context. What is the value added? So you systematically search the literature. You talk to your local librarian, you find some good databases, you even double extract the data. You tick off your PRISMA checklist boxes. You don't have time to register it in Prospero, but you do, and you don't combine similar outcomes of several studies into single estimates. So you write up this review. And now, what do you think you should call this kind of review? Is this A, an opinion piece? Any takers? Would anyone say, Joe Tucker, this is really just an opinion piece. Stop kidding yourself. Anyone? No? Would it be a scoping review? Raise your hand. So a good chunk of folks would say scoping review. Okay. Or C, systematic review without meta-analysis. Raise your hand. Anyone? A few takers. Or D, a systematic review with meta-analysis. Raise your hand. Or any other ideas what we should be calling this? No? So I think I think this case you could make arguments that it would be a scoping review or a systematic review without meta-analysis. It's definitely not a systematic review with meta-analysis because you're not combining the results of at least 2 studies. It's more rigorous than an opinion piece. And the boundary between scoping review and systematic review can sometimes be a little bit blurry. It's really a matter of rigor. And so I think it depends on the details of how rigorous this review was. Typically, without registering something in Prospero, a scoping review, generally speaking, when I'm writing these, you would undersell. You don't want to oversell your piece. So if there's uncertainty, I would say, focus on it as a scoping review and creating a scoping review that's really good rather than disappointing people with a systematic review that's just okay. And
Are we allowed to ask questions?
please, yes.
Well, so first of all, great to see so many people. We're going to run out of breakfast. The one question I had is about systematic reviews. I tend to see where you have two people extracting or 2 people looking at stuff and then another person looking at all of that. So if just one person does it, is it reliable enough or independent enough to be considered a systematic review? Thank you.
Great question. Fantastic question. And this actually came up in a WHO meeting 2 years ago. A very nice systematic review had a single author. And the methodologist at the WHO committee said, to be a systematic review, you really need 2 people. You really need to have data being extracted by 2 people. You need 2 sets of eyes. And for like a serious systematic review, I would say even 3 people would be, 2 people would be the bare minimum and 3 people would be more usual. So, and it's also taking the other part of this is, so that's sort of the most rigorous answer would say, you need at least 2 people. To do, a scanning of the literature, you don't necessarily need 2 people for that. So that you could easily do with a single person. But Dr. Sohn brings up a great point that really one of the first things, if you're thinking about doing a systematic review, is not to say, I'm going to do this all by myself, but to think about who's also excited about this topic. Who's a student or a mentor or a librarian where you could sort of build a team to get this done? Great question. So what are some examples of systematic reviews? Comparative efficacy and safety studies, looking at drugs, looking at public health interventions. Prevalence, so how common is a disease or different outcomes, diagnostic test accuracy, even qualitative research. So I'll give you an example of that in just a minute. So here we have an example of a comparative safety and efficacy study looking at HIV antiretroviral adherence interventions. And this is from Nathan, and you can see here are several different interventions. And actually, can you guys still hear me if I don't use the mic? Or do I need the mic? Yeah. So standard of care, this ESOC is the enhanced standard of care, and you can see these are different interventions compared to other interventions. So alarm compared to weekly short message. And this basically, counseling, peer support, and short messages can improve adherence to antiretroviral treatment. And then outcome prevalence. So here we're looking at causes of hospitalization among people living with HIV. And you can see TB, bacterial infections are really leading causes of mortality among adults and children worldwide. This is another example looking at diagnostic tests. So here we compared the sensitivity and specificity of a syphilis test, a rapid syphilis test, compared to a laboratory-based syphilis test. And it's a slightly different purpose. We're interested in positive predictive value. So this is one of our summary slides from this systematic review, looking at positive predictive value at different prevalence of syphilis. And basically, the take-home message of this systematic review was that rapid syphilis tests are accurate compared to the conventional tests. And then for those of you who do qualitative research, this is a different type of systematic review that synthesizes qualitative evidence. And here, you can take in-depth interviews, focus group discussions, really any kind of qualitative study, and pool the data, just like you would with a quantitative study. And in this evidence synthesis, we found that HIV self-testing can empower users, but it also might be associated with pressured testing in some contexts. And this is a newer method. So this idea of pooling qualitative research, there's a reference at the end that refers to more information about qualitative syntheses. All right, so quick quiz again. Which of the following is not an example of a potential systematic review? And again, just raise your hand here. Comparing HIV outcomes from selected studies. Anyone? B, exploring themes in published selected syphilis studies. Not an example of a systematic review. Anyone? Determining the sensitivity of a new test compared to a gold standard based on selected studies. No? Using mathematical modeling to estimate HIV transmission. All right, so this one is quite clear. And I should clarify, though, that systematic reviews can be very useful to inform mathematical models. So they can work hand in glove, but really a mathematical model isn't a systematic review. It's a separate piece of work. So what are the purposes of a systematic review? To provide a summary of the literature on a specific question using a standardized methodology that can be replicated, to assess the risk of bias within the existing literature, to inform experts and policymakers as they make decisions about guidelines and guidance, and then finally, to outline gaps. And this is something that we often forget about. If we say there are few papers from low and middle income countries, oftentimes these kinds of conclusions can be really useful to say, where do we need more research? If there's not a lot of research in this area, in this specific region or in this field. So it can help us find gaps in the literature. And in terms of the steps in a systematic review, first you develop a protocol. And I think back to Annette's point, really think about the team. Who else is going to be helping you with this systematic review? And if you are serious about this being a systematic review, registering it in a database called Prospero. So it's free to do. This is through the University of York. It's simple, doesn't take a lot of time. You basically go with your protocol once you have your protocol and fill out what's the purpose, who are your co-authors, what are the inclusion and exclusion criteria. And the protocol itself includes things like what are the databases that you'd like to search? What are your Pico questions? So Pico here, you see this come up again and again in systematic review. Pico stands for population, intervention, comparator, and outcome. And at the end of this, as part of our interactive session, we're going to come up with some Pico questions. So, and then risk of bias, analytical methods to be used. So once you've got the protocol, then you actually run the searches. And if it's a more rigorous review, you would do this in duplicate. You extract the data, and then you finally analyze the data. Questions? Yeah?
Yeah, how do you avoid biased perception? Because if you select, you're not doing a meta-analysis, you're doing an analysis of some of the data, all of the data.
And so how do you avoid bias at the stage of which articles to include and not include?
Correct.
It's a great question, and I think one important thing is to have sort of standardized criteria that you look through as you look at each either title or abstract. So if there's an area that's unclear, then your two people who are looking at each abstract can discuss and say, you know, what do we do with this sort of gray area? The other part is if you have two people looking at the same abstract, you want them to do it independently, right? So having two people where one person has already seen the results of the first person would be a less biased estimate. And then in terms of avoiding bias in the early stages of a review, the Cochrane Handbook has a whole bunch of other specific advice that would be good to sort of dive into. There are other kind of nuts and bolts things, but it is an area where there are some tips and ways to reduce bias. And that's a great question. So these are the basic steps. And then you finish your searching, you're extracting the data for the review, and then your mentor says, oh, wait a second, we need to register this in Prospero. What's the right time to register a review in Prospero? Would you do it immediately as soon as you have your broad topic? Anyone? B, once you have a review protocol? Good. C, after you finish the data extraction of the review? Anyone? No? Or D, after you finish the review. So you guys know this already. It's really after you have the review protocol, that's when you go to Prospero and register it formally. So, all right, so you've done your registration. What are the outputs of a systematic review? And we'll basically go through these and talk a little bit about some of these key outputs. So a flow diagram, sure.
Regarding that question which you asked, what do we do if we have already finished the data extraction, and then can we go on Prospero, or we do not register in Prospero at all?
Great question, and this comes up all the time in systematic reviews because you totally do the review and then wait a second, can you register it in Prospero? And I favor always going to Prospero, even if you've finished your data extraction. I think the official answer from the Prospero people would be that you still have to be, and there still has to be unextracted data for you to register it. But I would encourage you to look at it, even if it's very late, talking to the Prospero people, telling them exactly where you are with the review. It's better to know about the process, even if it's later. So I think it's a good thing to consult.
Yeah, just to follow up on that question, during the inclusion for studies, when you are looking through the abstract, suppose you have questions or criteria, the data of which is not available in the abstract. Do we include half data, part of the data, or do we remove the study from your review article itself?
So you're saying you can only find the abstract, you can't find the full text?
No, you can find the abstract, but the criteria that you're set for including a study, the data for the inclusion is not there, or it's partly there in the study. So you're not very sure whether the inclusion criteria is met or not.
It's a good question. So you don't have complete information. Generally speaking, I would say err on the side of including things at the abstract level. And then later, if you look at the full text and it's not available or it doesn't seem relevant based on the full text, then you can make an accurate judgment. But if you exclude something at the abstract level just because it wasn't reported in the abstract, then it might have been that just didn't make it into the abstract. Thanks. Good question. So a flow diagram. You've all seen these flow diagrams before. You start with titles at the top and citations, and then you go down to abstracts, and then you go down to full texts, and then how many studies were included. So this is basically an essential part, and I apologize for this being kind of small on the left here, but You want to, especially towards the end here, when you're excluding abstracts and full texts, you want to note why you're excluding the study. So what's the specific exclusion criteria that makes this study not eligible? And then this is also kind of a very boring texty table, but a study characteristic table that just has basic information about a systematic review is going to be expected. This is an important piece of a systematic review. And then risk of bias, we talked about this a little bit before. Here we're looking at each individual study and then determining how much bias there would be from that study. If you're looking at RCTs, the Cochrane tool is sort of the gold standard, and Cochrane has some nice guidance on this. For observational studies, there are a bunch of different tools, and I think it's a little bit more in flux. And there is also a Cochrane tool for looking at risk of bias in observational studies. It's slightly more complicated. And then a summary of outcomes. So this is just looking at, for the syphilis study, the location, the test name, how many samples, sensitivity, specificity, and then a forest plot. So you've all seen these before in published studies. You have individual estimates from studies, and then you have a pooled estimate here that reflects all of these studies. And then meta-regression, so combining outcomes, and in this example you can see this is the percent risk reduction in major cardiovascular events against the difference in achieved systolic blood pressure between study treatment groups. Annette?
So about the forest plots and the meta-regression, can you have a systematic review without that if it's not a systematic review and meta-analysis, or should you really have that? It's the first question. Yeah.
Great question. And so both a forest plot and meta-regression are really pooling more than one study. So this is the part of the talk where we're getting into meta-analysis. And if you weren't interested in pooling studies, or if you said, you know, these studies, they don't have comparable outcomes, or it could be for any number of reasons you decide not to do a meta-analysis, then you wouldn't have the forest plot or meta-regression.
And then the second question is, can you go previously one slide?
Yeah.
So when I read systematic reviews before that, sometimes I don't see this risk of bias table, either as a supplemental figure or in an appendix. And should I question the validity of that review if they are not providing this kind of information?
Great question. And I would say you really have to look at risk of bias for a systematic review in some way, that there would need to be I mean, it's an integral part of what a review does. And in terms of does it need to be in the full text, it more often is a supplement where this is not something, it's not terribly exciting, but in terms of looking at the quality of the data, if you don't have a risk of bias assessment, then how would you be able to grade the evidence and say this is very low, moderate, or high level of confidence in the review findings? So really, risk of bias is an important piece. And the other part of this is from the kind of student or trainee perspective, this is really the risk of bias. This approach of looking at all of these different domains is a more extensive one, and there are also risk of bias tools that are simplified. So it doesn't have to be this complicated. Good question. Okay, so we've already talked about this, when to do a meta-analysis, does it make sense? Resources, the Cochrane Handbook is very helpful. It gives you how-to advice. There's a whole Cochrane database of systematic reviews, and you can register a systematic review with Cochrane. You would want to do that early. The PRISMA statement and this checklist that I mentioned before are available on the website. And then Prospero, where you can register protocols, is at the end here. And the protocol registration can also be useful if this is sort of a hot topic and you're afraid that someone else is going to be looking at exactly the same topic. So by looking at this database of registered systematic reviews, you can see if anyone else has sort of laid claim to the same topic or a similar topic. These are a few other references that might be helpful. And for those interested in qualitative research, the Simon Lewin PLOS Medicine article from 2015 is a helpful reference that goes through how to synthesize evidence from qualitative studies. A few future directions: network meta-analyses can be really useful. Individual patient data meta-analyses. So what I mean by that is taking individual patient-level data. This could be from multiple clinical trials. It could be from multiple databases, and bringing those together. A living systematic review that's updated periodically. And then finally, it's near dear to my heart, crowdsourcing for systematic reviews. Much of the systematic review kind of machinery it's not rocket science, right? Looking at these titles, looking at the abstracts. So there are ways of using crowdsourcing and actually machine learning and other sort of computer techniques to assist with systematic reviews. These are all, I would say, the crowdsourcing is really more an investigational approach. But network meta-analyses, many of these have been published already. Individual patient data meta-analyses have also been, are very, this is an important field. So, all right, so for the next part, this is our small group activity. But before we get there, any questions about the content? I know it's a little bit of a whirlwind tour. Yeah.
Just one question about network meta-analyses. I mean, in those you often get estimates for, say, comparisons for a particular outcome when they've never actually been compared head-to-head in a clinical trial. How well accepted, or is there any criticism of network meta-analyses and the conclusions you can draw from them, or are they considered to be scientifically sound?
That's a great question. And I think you bring up a good point about head-to-head comparisons and what is the validity of these comparisons if there's no empirical data. I think this, from sort of a methodological standpoint, it would be, I would approach it with caution, that kind of as a gut feeling, even though you would have multiple points of data comparing these two interventions or these two exposures, it would be, I would be cautious. I think it's a good point.